Hi everybody, welcome back to our physical health series. This is episode 2, where we're talking about all things acute injury that happens with a sudden onset. We're going to go through how to manage acute injury on our own, what we can do to help ourselves, and especially if we don't have access to higher care, whether at all or right away. We're also going to go through some non-negotiables for when to seek higher care, when it's going to be a really big disservice to ourselves and our bodies if we don't get something looked at. And then we're going to go into some specifics of taking care of swelling, taking care of bruising, taking care of wounds, specifically abrasions, because those happen all the time, especially for aerialists. And then lastly, we're going to talk about concussions, okay? Concussions recognition and concussion management. All right, let's get into it here. Coming up first, because I don't want anybody to skip this, we're talking about when going to seek higher care. And when I say higher care in this case, I'm meaning like go to a hospital, whether emergency room or urgent care, whatever is available to you in the area that you're in. When we go through this list of things, this is when we know we need to seek higher care now. If we hit our head and suspect a head injury, so whether we have a mechanism that we get bonked on the head, especially if there's rotation involved, spinning involved, go seek higher care. If there is a suspected spinal injury, so we fall, we get pain in the neck, we have pain radiating into the hands, arms, or fingers, okay, or pain radiating into the legs. If we have numbness, tingling, or burning, whether that is in the neck, head, hands, arms, fingers, legs, or toes, legs, feet, or toes, do not try and move the person who has fallen. If you have fallen, do not try and move. Activate EMS, so call your local emergency provider and get them there as soon as possible. Okay, this is not something that we want to play around with, not something that we can be like, oh, it might be fine, might not be fine. Err on the side of caution. If we suspect a spinal injury, if we've been bonked on the head, get assessed by a medical professional. After that, all right, if we suspect a fracture, so we felt any snaps, cracks, pops from our fall, from whatever mechanism, and or if we have feelings of instability in the joint, in the limb, go seek higher care, go seek out an x-ray. Our bodies are really good at telling us what's going on. So if we felt or heard those things, go get it checked out. If we have a loss of pulse, motor, or sensation in a limb or a joint, so losing pulse, we can assess at the wrist, we can assess at the brachial artery at the arm, we can assess at the femoral artery at the hip, we can assess at the ankle and at the toes as well. If we lose one of those pulses, go get it checked out. If we lose the ability to move a joint, either you're looking at it and you can't get it to move, or if we get locking, so an inability to move a joint because you feel like there is a bony block, there is something blocking you from moving, not necessarily just pain, but there's something in your way, go get it checked out. Okay, and then if we lose any sensation, so same like we talked about for spinal injuries, any numbness, tingling, burning coming into a joint, even in the absence of a mechanism for a spinal injury, even if that is just like I hurt my wrist, but now like I can't feel my fingers, go get it checked out. We don't want to mess around with nerves. Okay, there could be a lot more going on there. Get it checked out by a professional as soon as possible to limit further damage that could happen. Dislocations. So even if you dislocated and it popped itself back in, go get an x-ray because chances are something there tore and or broke. Dislocations, especially if they don't spontaneously reduce, they don't pop back in on their own. But even if they pop back in on their own, go get it checked out. Okay, so those are my non-negotiables of when we're seeking higher care. But now we're going to talk, I want to go through quickly, just body part by body part, if there's anything specific we're looking for to go and seek higher care right away. Starting at the ankle, we have the Ottawa ankle rules. This is a lovely set of rules telling us when we need to do the thing. So if we are unable to weight bear for 4 steps, all right, either at the time of injury or in the ER, and we have pain either at the base of the 5th metatarsal, so the base of the pinky toe on the outside of the foot, the base of the navicular, so sort of in the midfoot, or in the malleolar zones. One of them, doesn't have to be both, but on the bony bits on either side of our ankle, then we need to get an x-ray. Moving up to the calf. In the calf, the main thing I want to just bring to people's attention here and make sure that we know about it, there's something called compartment syndrome. Within the calf, our muscles are sort of held in compartments, separated by fascia, separated by connective tissue. And if we get swelling in one of those compartments, it doesn't really have a lot of space to expand. So we get a lot of swelling that can compress the blood vessels, that can compress the nerves, which ultimately can lead to a threat to the limb, and therefore it is a medical emergency. So I want you guys to just be aware of the 6 P's of compartment syndrome and know what to do in the case of it. So if we have a trauma to the calf and we get excessive pain, okay, lots and lots of pain. We get pallor, meaning that we're losing color in the calf. It looks really pale. Also, it could turn red as well. If we have pulselessness, so we talked a little bit, or we're going to talk about cap refill. So pushing on the toe, and how long does it take for the blood to come back into the toe if that's really slow, or if we lose pulse at the toe or at the ankle, that's a sign. Pressure, so we feel a buildup of pressure in the calf. Paresthesia, big fancy word for numbness, tingling, burning. All right, any altered sensation in the calf, in the ankle, in the toes. And then poikilothermia, which is another big word, basically meaning that we're unable to regulate our body temperature. So if your calf is really cold for whatever reason, ankles, toes really cold, or on the other side of that, they're really hot and you're like, eh. Those are all signs of compartment syndrome. It is a medical emergency. So if we are getting some of those and we have that mechanism of trauma to the calf, please go get it checked out. All right, get to an emergency facility as soon as possible. Moving up to the knees, we have our Ottawa knee rules. So same like our Ottawa ankle rules, these are guidelines for when to get an x-ray. So basically, if we have a trauma or pain to the knee and we are 55 years or older, we have isolated tenderness to the patella, to the kneecap. We have tenderness to the fibular heads, that is the bone to the side of the knee, on the outside of the knee. We are unable to bend the knee to 90 degrees, okay? And or we have an inability to weight bear immediately after injury and in the emergency room, so when we get to higher care. That's when we for sure have to seek out x-rays. If we have an injury to the hip, okay, and you have an intense sharp pain, an intense sharp new pain, go get it checked out. As well, if we have a trauma to the hips or we land funny and we sort of get stuck in an internally rotated, so toe and knee pointing in, or we get stuck in an externally rotated, all right, toe and knee pointing out position, and we just like really can't and don't want to move it from there, please activate EMS, get emergency personnel on the site as soon as possible, if possible. We don't want to try and move out of those positions. Shoulder, same deal. The main thing we would talk about here specific to the shoulder is dislocations. If there is a dislocation with a spontaneous reduction that has come back in, I don't care if it's it goes back in. If it's your first time, go get an x-ray as soon as possible. At the elbow, if we have locking, like we talked about, we're unable to fully move that elbow because we feel a bony block. Same deal, go get it checked out. And then we have the triangle rule with the elbow. So when the elbow is straight, we want our 2 bones to the side and the olecranon, so the elbow part in the middle, to be in a straight line. When we bend the elbow, those bones make a triangle, okay? An isosceles triangle, so 2 sides are the same length, and then we have 1 long side. If in either the straight or bend position, we have deviation from those positions, so in a straight extended elbow position, we don't have a straight line, or in a bent position, we don't have our triangle, something's a mess in there, please go get imaging. In wrist, hand, fingers, any lack of pulse, numbness, tingling, burning after initial injury, and especially if we are losing our grip strength, please go get it checked out. In the hand, the main thing I want to bring attention to is the possibility of a scaphoid fracture. So the scaphoid is the bone between the thumb and the wrist. When we hurt this bone, there is a chance for what we call necrosis, which is just death to the bone tissue. So if we get pain where the thumb meets the wrist, all right, after we have a mechanism such as falling on the hand, please go get an x-ray and then follow up with your doctor. Follow up with it, because those fractures might not show up on an x-ray right away. We really want to act conservatively with there because of the risk for necrosis of that bone. Okay, so when we have an acute injury that we've determined we do not need to seek higher care for at this moment, so we don't need to go to the hospital for it, what can we do to help manage it, help it heal on our own? So we've all heard of RICE, rest, ice, compression, elevation. We're going to take that acronym, we're going to put it aside, and we're going to bring in a new one called POLICE. P stands for protection. Okay, protection can be anything from padding. So let's say we have a bruise, creating a pad for it. This can be something like supportive taping, not completely limiting our motion, but supporting the joint with some tape. This can also be something like bracing. Same idea, whether we decide to use a soft brace or a hard brace, something that limits us going into our painful ranges of motion, but won't completely stop us from moving. This can also be just overall kind of avoiding painful activities. So things that we know are going to make the injury worse or have a high risk of making the injury worse. All right, so if I have sprained my ankle, I'm going to avoid jumping for a couple days. Okay, because we know that maybe it's not super painful, but it could be really easy to land the wrong way and make that injury worse or cause a re-injury. O and L stand for optimal loading. So sort of along the same lines of avoiding painful activity, we don't want to avoid activity altogether. We still want to load and move whatever joint, whatever part of our body that we've injured, but we want to do so in a way that won't increase our inflammation or increase our risk of re-injury or increase our pain. So same example of a sprained ankle. I'm going to do my best to walk around. If weight bearing is really painful, maybe I'm using crutches to help me walk, but I'm still trying to get some weight bearing through that foot. As is tolerable, as doesn't increase your inflammation, so looking for redness, looking for heat, and that doesn't increase our swelling. So optimal loading, still keeping the joint moving, but avoiding aggravating it. And this is a little bit of a guess and check. We maybe feel okay and then realize, ooh, we did a little bit too much. That's okay. Just scale it back. All right. And avoid pushing it. This can also be something like if I hurt my wrist, I'm still moving my fingers. I'm still moving at my elbow as much as possible to promote blood flow through the area. After O and L in our POLICE acronym comes I. I stands for ice. And this might blow your mind a little bit, but I can't really recommend that we use ice for acute injury. I know it's the norm, it's the usual, but there's just a lot of research showing us that ice actually impedes healing more than it helps. We use ice to manage inflammation and swelling. However, inflammation and swelling are actually really important parts of the healing process. Excessive inflammation, excessive swelling, that's not great. Okay, that can cause further injury and prolong our return to play, return to activity. But they do need to happen in the initial stages of injury to let the body actually heal itself. When we use ice, it slows our cellular metabolism. So it slows the processes that are happening on the cellular level of inflammation, and then with that of swelling. Okay, so ice is really good for pain control. If we're in a solid amount of pain, we have to travel far if we need higher care, or we don't have access to painkillers or are allergic to painkillers, whatever reason, ice is good for pain control. However, ice is not good for managing inflammation, managing swelling. I don't want to get into like the nitty-gritty science of it here. If you have questions about it, message me. I'm more than happy to send you some resources, or we could even just chat about it. But ultimately, I know it's part of the acronym. For an acute injury, I can't confidently recommend that we use ice regardless. Moving on, after I, we have C. C stands for compression. Okay, this is actually going to be a lot more beneficial in managing swelling. So when I say managing swelling, swelling's going to happen, avoiding excessive swelling, okay, while still promoting healing in the way that ice won't. When we compress, we could do this in a few different ways. We can use something like a neoprene sleeve. So just like a thin, tight sleeve that can go over a joint and will help compress it. We can use an elastic bandage, or we can even use, if we don't have access to those things, like say it's an ankle, we can use like a tight sock. All right, say we're trying to compress on our elbow, still use a tight sock, cut the top off of it, use it to help provide some compression, some support. When we are using an elastic bandage, okay, and also for the other two things, but especially for an elastic bandage, first up, we're always wrapping proximal to distal, so from far away in the body to close to the body. And I'm going to check 3 things before and after I wrap. I'm going to check pulse and capillary refill. So I'm looking at the nail bed of either my hand or my feet, depending on what part of the body I'm wrapping. I'm going to push on the nail bed and then look at it and see how long it takes for it to go from white back to pink or red. We don't want this to take more than like 1 to 3 seconds. After that, I'm going to check motor, meaning I can still move my appendages that aren't wrapped on the other side of that wrap. Okay, so if I'm wrapping my ankle, making sure I can wiggle my toes. If I'm wrapping my elbow or my wrist, making sure I can still move my fingers. The last one we're checking is sensation. So you're going to get a buddy. They're going to tickle one of your toes or one of your fingers. You're going to have your eyes closed, and you need to make sure that you're able to distinguish which of those fingers or toes were just touched. Obviously, if we start to turn blue, if one of those things changes after wrapping, unwrap, try to do it less tightly. If that's not happening, try a slightly less intense technique, so using a sleeve or like just a tight piece of clothing. After compression, our last one for our police acronym is elevation. So just trying to lift whatever body part it is above the level of the heart. Obviously, if it's something like our shoulder, that might be a little bit tough to do. Something like our hip, that might be a little bit tough to do. But ankles or hands, wrist, elbow, knees, we can lie down, lift the leg up, prop it up on some pillows, or if we can be seated, propping up the elbow or hand, pillows, armrest, whatever works, but getting it above the level of the heart. This is using gravity to help limit excessive swelling. So these are all things that are going to help us manage injury when it happens. After a few days, we can increase how much we are loading. But if with these things we don't start to see improvement, we have excessive swelling, we have excessive inflammation, we're not improving, that's when we also need to go seek higher care when it's available. So next up is wound care. And here when I'm talking about wounds, I really want to just talk mostly about abrasions. If we get like a big scary puncture wound, or if we get like a big laceration, go get stitches. Go to a doctor, deal with that, okay? cover it up, apply pressure. If something is sticking out of you, do not remove it, have the doctor remove it. All right. But abrasions are something that we get a lot as aerialists and acrobats. So whether we are getting rope burn or mat burn, you know, scraping our knees against the trapeze bar or your hoop, any of those things, we rip our skin off quite a bit. Okay, so when we want to take care of that, step one is going to be cleaning out that area of abrasion, so that area that we have removed the skin. Okay, we can really just do this with water. We don't want to use something like alcohol or peroxide. Those will disinfect, but they also can cause more damage to the area. Clean water, or if saline is available in a first aid kit, saline is great. If not, clean tap water. If we don't have access to clean tap water, then using bottled water to just rinse it out. If there is any pieces of like tape, lint, fabric, gravel, anything like that in the wound itself, we can clean a pair of tweezers with alcohol. There, it's okay. And use those to pick it out. If it is excessive and there's lots of stuff embedded in there, then potentially seeking higher care is going to be your better option, but we can remove it with a clean pair of tweezers. Once we've rinsed the wound with water, then we can cover it with an antibiotic ointment or just petroleum jelly. We want to we use this to create a barrier essentially, so that more bacteria can't get into the wound, and it helps keep it moist. All right, keeping it moist is really important for the healing process. We hear a lot to like air it out. Keeping it dry can sometimes prevent those blood vessels from healing properly. As well, a lot of the times we get these abrasions in areas such as the backs of the knees, in the armpits, in the groin, and these are areas that are hard to keep dry and keep open. We're wearing pants, we're wearing tights, and as well to keep clean. So covering the wound, again, using an antibiotic ointment or anything just like petroleum jelly. And then applying a bandage on top of that. Once we have it covered, then we're good to go do our thing. If you're worried about that bandage moving, we can add something like Hypafix, which is a really sticky elastic bandage, and we can put that on top. We can use something like a neoprene sleeve, or we can add in an extra pair of tights. We can add in an extra pair of leggings. Anything along those lines to just give you a little bit more protection while that wound is healing. Okay, sort of same like we talked about optimal loading before. We can still do stuff, but we don't want to push it. We still need to let that wound heal. We want to keep the area around the wound clean. We can do that just with soap and water, and making sure that we're not getting soap really into the cut or the abrasion, as that can, again, like we talked about with alcohol and peroxide, it can also cause more damage to the area. We want to be aware of signs of infection. So if it's normal to have some liquid coming from the abrasion, okay, clear, slightly yellow, but translucent liquid coming out, normal. If that stuff starts getting thick, opaque, and we're getting like yellowy green, that's a big sign of infection. Okay, if we get red and hot around the abrasion, also a sign of infection. If we start getting red streaks coming from the abrasion as well, that is a huge red flag, big sign of infection. It means that we have an infection and it is spreading into our body, and that runs the risk of becoming septic. So in that case, go see your doctor, get them to clean it out really, really well, and probably give you an antibiotic. Otherwise, if we notice those signs, just make sure that we're keeping that wound super clean. All right, we're changing our bandage daily, and we're trying to limit re-injury. Please consider, if you scrape yourself on like an older piece of equipment, or if we're on dirt and we're not really sure what's in this dirt, to know when you last had a tetanus shot. And if you are unsure of it, or know that you have not had one in the last 10 years, to go get a tetanus shot. We don't want to run the risk of a tetanus infection from our scrape, especially if it's on something old and metal. Okay, we're gonna get just a little bit more in depth here about taking care of swelling and also taking care of bruises. So like we already spoke about, ice is not our be all and end all for swelling. Okay, we can have much better outcomes if we use compression, elevation, and also pain-free range of motion. So keeping the body parts surrounding wherever your swelling is moving. So say I have injured my wrist, okay, and my wrist is getting swollen, getting moving in my fingers, getting moving through the hand, okay, and getting moving through the elbow and shoulder is going to be really important to promote blood flow and muscle contraction through the area that will help decrease the swelling. We want to stay elevated as much as possible, so lifting the area above the heart, and therefore gravity can also help with this. In the ankle, same deal. If my ankle's swollen, I can move my toes around, I can move my knee around. I can move my ankle through pain-free ranges of motion. So even if that's just a little wiggle, it's better than nothing and will help manage that swelling better. So now for bruising, there's a couple things for bruise care and why it matters. So for when we bruise, like it happens all the time, it's not a big deal, but it becomes a big deal if we don't let that bruise heal appropriately and we keep injuring it in the same way, which I know is really common with especially with aerialists, or we're an acrobat, we're doing the same thing over, we keep falling on the same place, okay, or we're getting the same impact from our hula hoops or juggling balls, whatever it is. All right, we can get something called myositis ossificans. And it is just a big word meaning that we get calcium deposits or like bone deposits essentially in the muscle where that bruise is. So having those deposits there can then lead to things like a decreased range of motion, increased risk of injury for the muscle because of that lack of extensibility, and we can get persistent pain. Okay, so how do we avoid this? We avoid increasing inflammation and decreasing our risk of re-injury to the area. I don't want to like do a deep tissue massage into the bruise to try and knead it out. Like, please don't do that. Do not increase the trauma to the area that is already hurt. Okay, and we also don't want to do any aggressive stretching to the area. We can do just like some light massage to it, okay? Just essentially like just rub your hand over the area, promote blood flow, okay? But we don't want to be aggressive. We want to protect the area as well in the case that we know we don't really have an option. We have to do the same motion over and over again, even if it is bruising us. So we can use foam padding. So you can use a, like if you go to, I'm going to say Canadian Tire. I feel like a lot of people here aren't Canadian, but any sort of camping store or hardware store, and you have like camping mats or just straight up like thin foam, we can use that and cut that into shape for whatever area is bruised. We want to make it almost like a donut so that if we get hit in that area, it disperses the energy and it goes around the bruise rather than back on it. We can use things like knee pads or elbow pads. And you can buy, let's say if we want to use it on the thigh, buy a size or two larger so that we can slip it up past the joint. I'm going to use K-tape to show you how to, a technique to use to help manage bruising and swelling. What this does theoretically is that it helps lift the skin to help promote blood flow and allow blood flow and lymphatic flow through whatever area. Say I'm doing this for my ankle swollen. I'm going to cut my K-tape so that it will fit over that area. I'm going to make sure that I have rounded all my corners. And then I'm going to cut this into 4 strips, leaving the top base together. Rounding the edges is an important step. Having corners makes it more likely that we're going to snag it on something. All right, and now from here, I'm going to first clean off my ankle, okay, or whatever body part you're doing this for. I just have some regular old rubbing alcohol here. I'm going to clean off my ankle, make sure that I'm getting whatever dirt, oil, anything that could decrease the effectiveness of the adhesive. I want to get rid of it. I'm going to start by laying down this anchor. So I'm going to rip the backing. I'm going to take off the tape and I'm going to lay it down. We're going to do 2 of these. So I'm going to go diagonal across where my swelling is. So I'm going to lay my tape down with no stretch on this anchor part. I'm going to use the paper and I'm going to rub along the anchor for 30 seconds. Okay, this helps activate the adhesive. It's a really important step to help make sure that we are getting as good of a hold of the tape as possible. And then that helps the tape also stay on longer. All right, this stuff's expensive. We don't want it going to waste. All right, so now I'm going to lay down my strips with no stretch over my area of swelling, which is today for me my ankle. So I'm going to take the paper backing off. I'm going to do it with no stretch over my area of swelling. I'm going to make sure that I have some space between these guys. I don't want them to overlap. Okay, and then I'm going to do the same thing with a second strip going in the opposite direction. When I'm finished applying my web, I'm going to take the paper. I'm going to do the same as I did for my anchors. And I'm going to rub to create heat for at least 30 seconds to help activate the adhesive. Okay, so we can use this technique for any bruising or swelling, okay, to help the healing process along. We do not want to use this if we have any sort of allergy to adhesive. If we don't have an allergy to adhesive, we put the tape on and then we start to notice either right away or even within a day or 2 that we start getting some burning, some itchiness. Maybe we're noticing some oozing or irritation around the tape. Take it off right away, okay? Clean the wound, manage it like we talked about in our wound care section, okay? Just be nice to that area, be nice to the skin. If we have any history of blood clots or deep vein thrombosis, we never want to put K-tape over an open wound. So even if, let's say, we have an abrasion, I don't know if you guys could see in that, but I got some trapeze kisses on my ankles right now as well. But I'm not going to put tape over an open wound. Even if I cover that wound with something, even if I put a Band-Aid on top, I don't want to put K-tape over the Band-Aid. K-tape will pull. Its job is to pull the skin, so we don't want it affecting any of the healing, okay? Any of the like scar tissue laying for that wound. All right, and then also any sort of malignancy. So if we know we have a malignant cancer, do not use K-tape as it can, again, it affects our blood flow, it affects our lymph flow. We don't want it spreading that anywhere else. We can keep the tape on, okay? If we don't get any irritation, we can keep the tape on for 3 to 5 days. Okay, so the last thing we're going to go over today is concussion recognition and management. This is super important for a multitude of reasons that we'll get into as we keep talking about it. But number one, if somebody around you falls and experiences a loss of consciousness, seizures or convulsions, if they are vomiting or start experiencing nausea, if they start losing awareness, so they don't know where they are, they don't know who you are, they don't know what day it is, that kind of thing. If they start experiencing any numbness, tingling, or burning or weakness in their limbs, okay, one of them, all of them, two of them, if they start having that. All right, if we start going in and out of consciousness as well, so not just a complete loss or a lack of awareness, but are drifting in and out. If we have double vision that isn't getting better within a few minutes. If we also get increasing restlessness, agitation, or combativeness, activate EMS as soon as possible. Okay, that is a suspected head injury, head trauma. They need higher care. This isn't something we sort of wait and see what happens for. Why does concussion matter? All right, we hear about it, it's bad, okay, cool. What do we do? It matters for 3 reasons, 3 things we're going to talk about from here. Never mind the concussion itself, all right, that itself is an injury, but we have something called second impact syndrome. In second impact syndrome, we have an initial hit, okay, that causes an injury to the brain. If we get a second hit that is hard enough, causes enough damage, we essentially get an energy crisis in the brain, and then a severely impacted blood flow to the brain, and that leads to death. All right, it's only been documented in people under 23 years of age. That doesn't mean it can't happen in people older than that. It's just what we have documented right now, but it can happen. Okay, so if we do not take care of an initial injury, we keep going, we get that second hit to the head, it can lead to this, which causes basically an inability of the brain to function properly, and most often leads to death. After that, there's also post-concussive syndrome. So in post-concussive syndrome, we have a concussion that is not managed appropriately, or we get a second concussion after, or a third, whatever. That doesn't lead to second impact syndrome, but essentially stops our healing process, makes us start again. And this leads to persistent symptoms. All right, this can severely impact our quality of life, because symptoms of concussion include things like headache, depression, anxiety, brain fog, fatigue, tiredness, change in personality. All right, never mind neck pain and all that. So post-concussive syndrome can have a huge impact on quality of life and our ability to function, and we don't want that to happen. And then the last reason why, it's really important to manage concussion is that there is an 80% increase in risk of a second injury, okay, not related to your concussion, after we get a concussion. So if you've hit your head and you do not manage it properly, there is an 80% chance of you hurting another part of your body unrelated to the concussion afterwards. Before we move on to symptoms of concussion, I want to talk a little bit first about the mechanism of injury, so how it happens. Concussion is caused by acceleration forces to the brain. Okay, so something that essentially, if we think of our brain as like a thing of jello, and you have like a jello mold and you hit it and it just like jiggles, that's what happens to the brain in a concussion. Okay, and it causes our neurons to move, our nerve cells to move in a way that hurts them, alters their function for a little bit. So I don't have to hit my head to get a concussion. For sure, if I hit my head from the side, from the front, okay, or if I'm spinning and go and bounce off of something, that can totally put acceleration forces to the brain. But also, if I go and I fall on my butt, that is enough force to come up and can cause acceleration forces at the brain, causing a concussion. If I fall on my side and whip my head enough, that can cause a concussion as well. Or the same if I fall on my back and whip my head, the same can happen there. Okay, so we do not need to get hit in the head to sustain a concussion. Symptoms of concussion, because it's a brain injury, our brain does a whole lot of things. So the symptoms can vary quite widely. So I'm going to list a few here, but I'm going to put a full symptom list in the show notes. But we can have things like, and this is We can have some of them. We don't even have all of them. We may not have any of these that are in this list, but it can include things like headache, dizziness, nausea, anxiety, increased emotionality, okay, or decreased emotionality. So let's say, had an athlete who is like big burly guy, and he just came up to me and he's like, I hit my head and I'm going to start crying. And that was his tell, is that increased emotionality that wasn't normal for him. He knew something was wrong because of that. Okay. But also, if we're very just like emotional people and all of a sudden we feel very apathetic, that can also be a tell. We can have things like tiredness and fatigue. We can have trouble falling asleep or trouble staying asleep, any sort of sleep disturbance, difficulty concentrating, sensitivity to noise or light, something like brain fog, and even just like, I don't feel right. Like I don't feel like myself. Okay. Those can all be symptoms of concussion. If we suspect a concussion, it's really important to go get assessed by a medical professional. There's a lot of options for this now. There's a lot of people doing online assessments. If you don't have somebody near you who can do it, or you don't have somebody traveling with you who can do it, but like starting treatment as soon as possible is really important. So we got to go get assessed by a doctor and then start getting treatment from either somebody that they refer you to or somebody who you find on your own. You generally, physical therapists, athletic therapists, chiropractors have some experience in concussion management. If the doctor recommends to you cocoon therapy, so this is where we sit in a dark room for 6 weeks and don't do anything, please be wary of that. We know that is not the best way to manage a concussion. We know, in fact, that it is detrimental to our healing and can prolong healing and prolong symptoms of concussion. So we want to start with sub-symptom threshold activity, so we can continue doing activities that do not exacerbate our symptoms. We want to limit things like our screen time. Okay, it doesn't mean not have any. If you can tolerate a little bit of it, that's okay. If you can tolerate some activity, that's okay. And when I say activity, I mean things like walking around, really light exercise. In the circus, we want to avoid things like spinning, like inversions, okay, for quite a while, even after our symptoms have stopped, all right, because those have they can increase our blood pressure quite a bit and can have quite an impact to the brain. So it's very easy for those to restart those symptoms again. All right, this is why it's really important to work with a qualified medical professional when going through your concussion rehab. But the moral of the story here is, if you are recommended to do cocoon therapy, please be wary of it. Doing nothing is not the answer here. It's doing what you can without exacerbating symptoms is what's really, really important. Alrighty, thank you guys so much for joining me today for this episode. We went over how to manage acute injury on our own, but also when to know when we need to go seek higher care. All right, when we will do a disservice to our body and cause risk for a lot more harm if we do not seek higher care. We talked about how to manage bruising and swelling, all right, and it's a K-tape technique for that. We talked about wound care, especially for abrasions, which we get commonly in circus work. All right, we talked about concussion recognition and management. If you guys have any questions for me, any other topics that you'd like to see come up in our next episodes, please do not be shy to reach out, either comment here. You can get me on Instagram at bendontbreakat, or at my website, bendontbreak.net, or on Facebook at Bend Don't Break Athletic Therapy. Thanks so much.